Alright, so I'm going to do a BiPAP setup. So the first thing I'm going to do is check the patient's chart, gather any necessary details, like if the doctor wants a certain setting placed onto the patient's machine, and gather the necessary things. So like gather a few different mask size, the corrugated tubing for the machine, the bacterial filter. You want to make sure you have distilled water if they need the humidity with a certain type of devices. So when you're ready, go ahead and knock on the door, introduce yourself, wash your hands, check the patient's ID band, get all the pre-vital signs and everything. And in the beginning, what you can do is check the patient's, measure the patient's for the mask size that you need. And so then you go ahead and measure from bridge of nose and down around to the mouth to make sure you have the appropriate big enough size and not too small. So when you're ready to go, you're gonna go ahead and get everything set up over here. So you're gonna have your connections. So you're gonna have your piece here that connects to your machine, and then in between the corrugated tubing and that, you want to have your bacterial filter. So you have your filter right there, and then you have your corrugated tubing connected. So you always want to make sure you have your translucent tubing, which will help with your pressure to set off any alarm that needs to be set up for the patient. So when you're ready to start this machine up, what you're going to do is hit your standby. You want to make sure it is plugged into your outlet. And you're going to turn it on, and it's going to alarm off. And then when it's ready to go, I'll bring up your main interface here, and it'll show you what mode you are set in. So right now we're in the spontaneous time mode. So if the doctor would want to be in that one, so this one would give you a non-mac time breath for a patient that may be breathing spontaneously, anything like that. And so one thing you can check, so that sound you hear right there, that indicates that the patient has an obstruction between the mask and your machine. So with your spontaneous time, so you have your inspiratory, you have your expiratory pressure timing here, and then you have your rate per minute, how many rates per minute, and the rise time, and your inspiratory time with the ramp time and ramp start. So on your right side of your screen will show your patient's data, the rates per minute that they have, their estimated tidal volume, minute ventilation, leak. It'll show how many liters per minute is leaking from your machine to your patient's mask. The apnea, 4 per hour, so it's going to give 4 per hour there. Now if you want to change modes for a patient like with sleep apnea, you go up to your tier mode, you'll hit enter, and it'll give you two options with this Respironics BiPAP Focus. So that you either have an spontaneous time or a CPAP mode. So for like sleep apnea, for the continuous flow pressure and stuff like that, you'll hit enter. And the first thing it'll give you is the proposed CPAP. So with this is where you need to set up your appropriate settings. So your CPAP settings, your ramp time, however many minutes you want the ramp to go, and then your ramp start. And so then when you're ready, always remember to activate, or else you're going to go back to the mode setting you were on before. So when you'll notice if it needs to be triggered, the patient will be triggered, or anything like that. So here you can see your set ramp time that you set, and your ramp start, and then the CPAP. So if you want to change your alarm settings, you go over to your change screen. So it's going to change over to your alarm settings where your apnea is. So it'll do every 60 seconds, and then it'll do an apnea number of 20 per hour. And so you can always go ahead and change that. You can do a quicker, so you can do 40 seconds instead of 60. But when you're ready to set it, you hit enter to set it. And then you can go over the change screen, and you can just change your display units to your centimeters per water or your Haskell's units. And then you can also change your alarm volume. So you always want to make sure it's at a point to where you can hear it at the nurse's station, or if the nurses can hear it, that way we are notified that we need to check on them. So you would hit OK once you're ready, and when you want to go back to the main interface, you hit change screen, and it'll go back to your main mode. So when the patient is on a BiPAP machine, you always want to go ahead and recheck them to make sure they're doing okay, check their vital signs, respiratory rate, anything like that. You can also see if it is the right therapy for them by checking their EVG. You can draw an ABG to check to see if they're getting too much CO2, or and just kind of see where their oxygen levels are at with it. So then when you are finished and everything, you're done with checking the patient and they're done with the machine, what you need to do, there's no just standby to leave the machine on, so the next thing is the power button. So you'd hit your power button, and you'd hit the down key, and you'd make sure the OK is highlighted, and you hit enter, and it will completely shut off your BiPAP machine. So always, when you ever do it, check vital signs, wash your hands, remove any PPE, document in the patient's chart, and notify any personnel that may need to know about that patient.